Like, in your words, what brings you into here?
Well, I've been wrestling for 8 years.
Oh. What kind of wrestling?
Professional wrestling, WWE.
So you're thrown around a lot.
Yes.
Okay, let's put it that way.
Exactly.
Are you jumping and you're landing?
Yes, I'm landing, I'm falling, and I'm getting slammed on the mat.
Okay, so the impact.
Yes.
High impact here.
High impact. Okay. Right now, my lower back, I actually got x-rays on it.
Okay.
It's nothing, like, crazy, but they said that my pelvic bone is tilted forward. They've just been giving me, like, rehab exercises and stuff.
Okay.
Yeah.
And has it been helping?
Yeah, I'm, like, way better.
Okay.
Than, like, a month ago, for sure.
Okay. And what was your pain level a month ago then?
Like a 10. It was pretty bad.
It was low back.
Low back.
Could you not walk? Or?
Yeah, I had a match and then, like, I woke up the next morning and it was really hard for me to get up. I, like, slid off of the bed onto the floor and then I couldn't even, like, put pressure onto my knees. Like, I couldn't even crawl. So I've been off for a little bit.
And that was a month ago, you said?
Yeah. Mm-hmm.
Do you notice that certain activities beside, like, in the match where your back will hurt?
If I take a bump, like, if I get slammed, like, on my butt, like, on my lower back, then I'll, like, feel it, like, ache a little bit. Okay. But then it goes away,
Okay. And there's no way to avoid that? They have to throw you like that?
Yeah.
Yeah, because that's going to be hard. If you're thrown on your butt,
your
lower back is just going to take a beating.
Yeah, I'm just trying, I'm just trying to learn to use my core more and, like, activate my glutes when I take a bump.
Pretend this is your lower neck and this is your lumbar. Okay, and this is your thoracic spine. It's just, all of this, the extra work is going to go here and not here. So what I have to do is try to adjust the thoracic spine, okay? Try to mobilize these pieces, and then what happens is you can get them all to move again.
Oh, okay.
The thoracic spine is just rigid. So that will help some of the impact.
Okay,
because if I can distribute the chest wall and the thoracic spine can take a lot. The low back, it doesn't matter how much you activate your core. Not to say that you shouldn't do that, but it just can't compete. It just can't compete. The pelvis is huge. If you look at that model over there, the pelvis is huge. Low back is itty bitty. Mm-hmm. Then we have this thoracic spine above it.
Yeah.
So we have two rigid structures and a really mobile structure in between. So when you fall, that lumbar spine just takes the impact. Mm-hmm. So you're going to see me probably not work that much on your low back. It's probably doing just fine. It's just injured.
Yeah.
So I need to calm that area down and activate above and below.
Okay.
Turn sideways for me. Do you mind? I'm just going to feel your low back.
No, please.
Okay. Yeah, it's right here.
Mm-hmm. Yep, that's exactly where it is.
Yeah, it's right here. I can see it. Okay, that lower lumbar.
Mm-hmm.
Okay, go ahead and just walk to the edge of the carpet for me. Your pelvis really goes to the left. And then again, you really pushed that.
Yeah, I've heard that. Like, when when they were checking me and I, bend over, they said that I kind of, do this.
Really track to the left. Mm-hmm. It's okay. Just when I go to adjust you, I ain't going to shove it further.
Okay.
To the left.
Yeah.
Okay. And this hip socket here will be more compromised.
Yeah.
Okay? So I've got to be careful this whole leg when I work on you. So people are like, why do you do that? I'm like, so I don't, yank your foot off or I don't strain you.
Okay.
Okay. Go ahead and have a seat there for me again. See how this is stuck over here?
Yeah, I feel that.
Yeah, 1, 2, 3, 4. Over here. Very
Oh, yeah, that's fine.
Right. You see that? I'm poking. Okay, cross your arms for me. Like this. Good. I'm just going to go like this down the mid-back, okay? See if there's anything sharp. You can see how tight that is. And then watch me get to your low back. Whee! Okay, I don't need to be doing too much down there.
Yeah.
Okay, it's all here. I'm going to turn you this way. Anything feel tight? Anything that way? A little bit that way? Okay. And then arms over your head like this. I'm going to take you to the side. Anything hurt when I do that?
No.
And anything hurt when I do this?
No.
Okay, cross your arms one more time for me. I want you to tell me if anything hurts when I do this, okay? Any pain there?
No.
Any pain?
No.
On your back for me. My hand's going to go in the small of your back.
Okay.
Okay, I'm going to be feeling the pelvis and the low back at the same time. It's right here. Okay. There she is, right there. Okay. Any pain?
No.
Nothing. I'm gonna really go into the lumbar. Anything there?
It's just a stretch.
Okay. Looks like it healed just fine. Anything? I feel the low back engaged here.
Yeah, it's not hurting.
Nothing's hurting when I do this.
Mm-mm.
If I bring your knee to your chest.
No, that's still just a stretch.
Just a stretch?
Yeah.
Okay, that's all good. It's all good things, okay? It means it healed and it's doing good. Anything here?
No.
Now I'm like putting more pressure on that L5, S1 by doing these. I'm going to push again. Anything there? Okay. Test your SI joints, pelvis. I'm going to put both hands right here.
Okay.
Any pain when I do this?
No.
More anterior over here, so your pelvis is rocked forward. Again, that left side.
Mm-hmm.
Right here. No pain though when I do this?
No.
Okay. I am feeling a slight left swelling, but sometimes it's not enough to give you a symptom.
Mm-hmm.
Pain is not a really good indicator of how you're doing.
Right.
You know? It's like your teeth. You know, a cavity can burn through your tooth and it's not going to hurt until it hits the nerve.
Oh.
It's kind of similar with the spine. It can take a lot until it goes, I'm going to run my thumb down this track right here, okay? That's it. I'm going to spend a little time here if you're okay with that.
That's fine.
Just relax your head for me. I got you. Yeah, there's quite a bit over here. Now you are going to be really loose for a few weeks.
Sounds great.
So be conscious of that though.
Okay.
And here we go. I'm going to take this one down. Take a deep breath in. Here we go. That was my hand. Oh. It's T1 rib. Are you okay?
Mm-hmm. I feel it.
I'm going to reach into here. That's it. Okay, good. One more. Up at the top of the skull. There you go. Wow. Doing okay?
Mm-hmm.
It needs a little bit of work there. Good. Breathe. Oh my goodness. There we go. It's not as thick as the other side, but it's still there. Good. You okay?
Yeah, great.
I went straight to knuckles on this side.
I'm for it.
There you go. It's almost gone. Check it one more time. A little bit lingering right here. You okay?
Mm-hmm.
I'm gonna keep asking you. You all right? If I feel your muscle quiver, I kind of stop. There you go. A little bit of crepitus on this side. It's small. It's like crunchiness, you know, like a little bit of scar tissue over here. I didn't feel that when you were sitting. Right in the middle of the neck, right here. So that's like a repetitive motion. Your body's put into like a piece of glue.
Okay.
It's beefed that segment up for whatever reason.
Yeah.
Here you go. Okay, One more down at the bottom, very bottom. Okay. Ready for the adjustment?
Mm-hmm.
Chin back for me. Right here. Okay, that's all it's gonna go. Is that okay?
Mm-hmm.
Go back. Excellent. Breathe. Woo! Look at that. It's nice. Whee! Okay, I'm gonna leave that alone. Very good. Nice. Now just try to keep that neck up. I'm gonna go to your toes.
Okay.
Okay, here we go. Oh, they don't really crack too much. Oh, that one does. That one, no. Are your toes sore at all? Are you okay?
Yeah, they're fine.
Okay. Good. Excellent. Wait, this is stuck. Good. Okay. Not pull too hard on that one. There you go. Excellent. There's a little bit of the knee there. You okay?
Mm-hmm.
Any tenderness when I do this? Anything there?
No, it kind of tickles.
Like I just feel a little trigger point right there.
Uh-huh.
So right here.
Uh-huh.
You know, feel that?
Yeah.
That's a knot right there. Your knee is no knee pain though?
No.
Okay. Just I don't want you to develop knee pain. So
Okay.
if you want to just work on this, it'll help save your knees.
Yeah.
Right in here. You just get a foam roller and roll on them.
Okay.
It's kind of hard for another person to do it. It's easier when you're doing it on yourself. And this leg,
It just tickles.
oh wait, there's one up here. Right here. Right there. Okay, so you got one here
Okay.
and two here. Yeah, see this left-hand side here?
Mm-hmm.
Okay, I'm just gonna tuck this down. Just two here, not showing anything.
Okay.
Yeah, like look, coming right here. She's just swollen here on the left. And see, this side is just more pliable. There's no swelling here. And then it stops about here. All right, I'm just gonna pull on the fascia here. No disc or anything, just the skin, okay? No adhesions. None. Oh, hi. All right, I can crack that one really quickly. Take a deep
Okay.
breath in. Oh, yeah. There we go. Excellent. Okay, how's that? Is that
Lovely.
okay?
Yeah.
All right. More stuff like that coming up, okay? Like I said, the neck is probably the worst one. I mean, if you're going to call it a worst one, you know.
Right.
That one's the most intense. The rest of these are pretty easy. Okay, take a deep breath in. Oh, yeah. Good. And again. Excellent. And again. Good. Take a deep breath in. Can't get these upper ones. So, there it goes a little bit. And again. Okay. There we go. She's got plenty of knots down here to see. So this is your thoracic spine, the lower thoracic spine right here. Okay, right there. And then it's lumbar. So that's about as low as you place a foam roller right here.
Okay.
Don't place it in your lower back. right on that last rib. You can go all ham on this one, okay? Breathe for me. Let me see if I got it. Okay. Did good.
Okay.
So where I'm going to be is the top of your iliac crest right here. And right here. So again, top of the pelvis, bottom part of the thoracic spine. Is that okay?
Mm-hmm.
Okay, I'm going to wiggle your leg. Kind of jostle this loose. You're kind of losing this curve here.
Uh-huh.
And right here is one. Back to this one. Do you mind if I'm showing the side of your hip here?
Oh, that's fine.
I don't have to, but I just want to, like, right to there.
Okay.
Because I can feel it right here. Okay. Yep, here we go. Breathe. Take this one out. There it goes. Perfect. Oh, here's that side joint right there. This is what I'm going to adjust.
Okay.
This guy right here. That's the pelvis. Okay. See this? This is like, well, no, I lied. Look at that. Yeah, side joint. Well, you never know what you'll find. I lied. Look at that. Oh my goodness. Woo! Can make predictions, but sometimes
I'll surprise
you
you.
surprise me. Like, whoa. Oh no. Oh. This is all okay. I got it now. I figured it out. I'm gonna go with my elbow, okay? As long as you're okay with it.
Mm-hmm.
Excellent. Breathe. Good. Another side. Ooh. This is the compensation. You okay?
Yeah.
Okay. See, that's a little bit of scar tissue. Well, small wonder with your profession. Scar upon scar. There you go. I have to watch. Are they public, your shows?
Yeah, they're
your matches?
Yeah, they're live every Friday.
Oh. Let's go back and watch some. See what you do. I'll be like, that's the move that caused this.
Yep.
There you go. Okay, now it's time to work on the upper back, okay? Here we go. This is the mobilization of the rib cage that we're talking about. Does that hurt right here? Is it sore?
Yeah, it's sore up there.
Okay, then I'll be conscious of it. Breathe. Oh, okay. You're okay. You got it? You're okay?
Mm-hmm.
Okay. Flattening it out. Shaving it down. We're going to have both arms behind your back. Just like cross them like that. Yep, and I'm going to go down the middle part of the scapula, okay? Perfect. And again. Good. We're going to take this and go up and over, and you're going to grab elbow to elbow. Is that okay with your shoulders?
Yeah.
Okay. Down. Yep, back to the pad. You're doing good. Deep breath in. Good. I got it. I'm like, nope. Okay, how does that feel? That's the scraping.
That's great.
Okay. So yeah, do they have like teachers that teach you? Do they like other women that teach you how to do this, or?
Do like wrestling?
Yeah.
Yeah. We have like a whole women's class.
That's great.
Yeah, we have a bunch of trainers actually. We have like a really big performance center.
There you go. You're not bruising too bad.
Okay.
It's there, but it's nothing gruesome.
Damn it.
Dang it. Well, I haven't gotten to the upper back.
Okay.
But this is the lower back, which is generally more mild. But I'm not pulling I'm only pulling out like one rib over here, and it's done. Ooh, a little bit more congestion on this side. Right there. You okay?
Mm-hmm.
We'll take pictures. Because it never looks as bad as the first few seconds of doing this. It looks the most gory the first few seconds. First half an hour, then it calms down quite
I do love
quickly.
the gore.
We'll show you your lower back and then your upper back. Okay, that's done. Okay, okay. Just some oil so you don't tear up your skin. So your skin is still intact. You know what I mean? There's nothing wrong with your skin. It's just bringing that metabolic waste to the surface. At least that's what we think. Allegedly. We need to suck it out and send it to a lab. But wait, that costs a lot of money. We do note that it increases range of motion.
Love that.
Oh, so you can see the T4 vertebrae is the one that's the most inflamed on her. When I was feeling her back, I was like, oh, that's stuck. And that's where the buildup is. That matches. It's your rhomboids. It's underneath the trapezius there. Yeah, look at that. Ooh, now that's some petechiae.
I knew that was gonna be the spot.
Elbow to elbow again like we did before. Now this is a little ticklish, so I'll be careful. Is that okay? Okay. Yeah, right there. You tell me if it's too much, okay? I'll stop. But there is a little buildup here. Okay. It burns me. Like it burns us. Okay, that's what I have to do there. Other side, just for good measure. This is for shoulder range of motion, okay? You swinging punches. I want your humerus to be nice and free and not be injured, okay? I want that scapula to move around. What happens is if the scapula gets stuck, the humerus takes the brunt of the force. So you see me working a lot with the scapula to try to open up that shoulder. Let me just check it. Feels good. Feels nice. All right. Neck. Let's take a picture of it for her, and then we'll do the neck. Well, how do you feel in general? You're okay?
Good. Yeah,
Okay.
I feel great.
Not too bad.
Yeah.
Because I need to go right here on you.
Okay.
Okay. It's just this pec right here gets tight on everybody.
Mhm.
On everybody. So it's not that bad over here. It's nice over, like it's not knotted up over here. This side is there. It's not too bad though. For all the stuff that you do. It's not like overly, just right here, okay? You wanna feel it? It's right here. Right there.
Mhm.
Okay, so what happens is that I guess when you're throwing, you're pushing, you just don't want any one segment to be over contracted compared to the other, like what we were talking about. So I kind of run through the whole thing and make sure that it's all moving.
Okay.
It's my best option for the low back.
Okay.
Believe it or not, people are like, why is she like all over? But because gotta leave that alone.
Mhm.
Move as much as I can everywhere else. It's just right here. Then your hand behind you, just grab the table. Yep, how's your low back? Still okay?
Mhm, great.
Okay. Okay, right here. And one more. There it goes. Oh no, I missed it. So sorry. We gotta get pec minor first. Okay. Good, excellent. You can relax this down. Good. I don't look at your faces during this. I feel sad and I stop. So I don't watch you guys. I'm like, I look away myself.
I like it. I'm like, oh, we're doing things.
Oh, there's I missed that one. Well, we didn't miss it now. We've got it. It's like, ooh. First rib there. Okay. Not too much came out in the neck.
Okay.
I feel like we need to take another picture of her. Okay.
Ooh, fun. I
So,
love
yeah,
that.
that came out. Now, do you see
Yeah.
that? Your neck wasn't as eventful. It just didn't have anything for us.
Yeah.
But your upper back, definitely.
Okay.
Lower back. Here's with the two on the
Yeah.
side here.
Okay.
Right here. See, this is your lower back. It wasn't.
Right.
This was.
Oh, that's
was-
beautiful.
Okay. Okay. Is this a tattoo on your ear?
No, it might be
Oh.
hair dye.
Or maybe you hit yourself. Is it a bruise? It kind of looks like a bruise.
Oh, you know what? I did get hit in my ear a couple days ago. So.
You see that on her ear?
Yeah, I did notice that.
Yeah, she's just got like a bruise there.
Yeah.
Is it sore when I push?
I did notice it afterwards. I was like, oh, it's like a little puffy and a little tender. But it's
careful.
fine. Yeah. It's not bothering me.
You're like, oh, it's the hair dye. I'm like, I don't think hair dye does that.
Oh.
Is it hurt real bad when I do this?
No, not at all.
Right, lean away from me just a little bit. Good. So that's all it is. I'm gonna go around the bruise. Okay, good. It's not too injured. Okay, it just must have been on the surface. Same thing here. And lean away. Good. Oh no, that one was that was an adhesion. That let go there. It's
Oh,
good. It's
okay.
good.
Yeah.
Yeah.
I didn't even know you could adjust your ears.
If there's something there,
Yeah.
I can release it.
Uh-huh.
Like this side, even though it has the bruise, it didn't have any
Right.
injury.
Okay.
There wasn't anything with the auricular cartilage that
Right.
was damaged.
That's so interesting.
Whereas this ear, something has happened to it.
Mm-hmm.
We're gonna do the shoulder joint.
Okay.
Okay. All right, and elbow back. Harder for me. Good. That's as much as it goes. Elbow. Good. And lean away. Look at all these fun tattoos. Ooh, speaking over the cracks. PMA. What does that stand for?
Positive mental attitude.
Oh. Elbow back.
Ooh.
Good. Like I said, if it doesn't go, it just doesn't need it.
Mm-hmm.
Oh, I'm looking at all your ones. I usually look at the bone, but I get distracted. I'm like, oh, we got a heart. Ooh, is anatomically correct? They did a good job. Good. Excellent. Did that hurt at all?
No.
Take a deep breath in. I'm just going to push it back in. Inhale. Good. Excellent. Other side. Then we have you back. That's it. Oh my goodness, that's so tight. I did not expect that. You're like so flexible, and then it's like, are you okay?
Yeah.
Does that hurt?
No.
Okay. Take a deep. Does this hurt? Are you sure?
No.
Okay. Your body is just really fighting me. Deep breath in. There it is. All right. On your back. Bend both of your knees for me. So press out against my arms as hard as you can. 5, 4, 3, 2, 1, and squeeze. Let's see what happens when I squeeze. Just squeeze. Okay. That's all you need. Flip over, like you can be up on your elbows if you want.
Okay.
Yeah, and I'll show you what I mean. Okay? So give me one hand. Okay. Bend. Can you feel somewhat back there? Okay, this is an SI joint right here.
Mhm.
Okay, like take your knuckle, kind of. Feel that?
Yeah.
That's an SI joint. That's not your low back.
Okay.
Low back begins here.
Uh-huh.
Okay, in the center.
Yeah.
And it's centered the whole way up. SI joints, you have one here and one over here. There's two of them.
Okay.
Okay, one for one side of the ilium and another one for the other side. Okay? That's what I adjusted, were these guys. And they moved. But if you really want them to move, I gotta come in here with my elbow and get rid of that scar tissue that's there.
Okay.
So, it's kind of one of those things like to be filmed that.
Right.
I have to ask, like, are you okay with me, like, literally being on your butt?
Yeah.
Because it's right there in the SI joint. I did the iliac crest up here, but I didn't come down here. I did, the top part of it. But see that?
Mhm.
It doesn't need much. And if your leg goes numb, tell them to stop if anybody's doing this to you, okay?
Okay.
Because the sciatic nerve is right here.
Oh, okay.
It's a very dangerous move. It can be.
Right.
If you don't know where the nerves are, you can pinch them. If the therapist isn't aware, they usually are, but some aren't. You gotta be careful who you let work on you.
Right.
Here's the other one. Okay. Anything still feels stuck?
No, I feel great.
Because they're going. Feels okay.
Yeah.
All right. Then I'm gonna leave you with that.
Perfect.
Because if it feels good, then I'm just gonna leave it
no,
alone.
I loved that. Thank you.
Okay. Well, all right. You let me know how you feel the next few
Yeah,
days.
definitely.
Okay. I know you like to
I know.
lean on that side. Can we do the other side? I gotta go watch her shows now. See what she does. Well, maybe I'll have some input if I see anything.
Yes.
On her.